Hello and welcome to Nurse's Handbook. Today we will be discussing some multiple choice questions from microbiology. Question number 1. Who is considered as the father of microbiology? Robert Koch, Louis Pasteur, Joseph Lister, Karl Landsteiner. And the correct answer is Louis Pasteur. Louis Pasteur is a French biologist and he is regarded as the father of modern microbiology. Question number 2. Identify the following culture media: nutrient agar, blood agar, McConkie agar, chocolate agar. And the correct answer is blood agar. Blood agar is an enriched bacterial growth medium. Certain organisms do not grow easily on culture media as they demand a special enriched nutritional environment as compared to the routine bacteria, and they are known as fastidious bacteria. There are two major uses of blood agar. First one is to grow wide range of fastidious bacteria such as Haemophilus influenzae, Streptococcus pneumoniae and Neisseria. And the second one is to determine the type of hemolysis. Question number 3. Depending upon the oxygen requirement and metabolism, Vibrio cholerae species are obligate anaerobes, facultative anaerobes, obligate aerobes, microaerophilics, and the correct answer is facultative anaerobes. Facultative anaerobes are bacteria that can grow in both the presence and absence of oxygen. In the absence of oxygen, they survive by fermentation or anaerobic respiration. Question number 4. The process of reducing the amount of pathogens on any article surface or medium is called lysis, disinfection, incineration, sterilization. And the correct answer is disinfection. Disinfection is defined as the treatment of surfaces, equipments using physical or chemical means such that the amount of microorganism present is reduced to an acceptable level. Question number 5. Type 1 hypersensitivity includes all of the following except hay fever, anaphylaxis, extrinsic asthma, autoimmune hemolytic anemia. And the correct answer is autoimmune hemolytic anemia. Type 1 hypersensitivity occurs as a result of exposure to an antigen. Autoimmune hemolytic anemia is an example of type 2 hypersensitivity. It is an antibody-mediated immune reaction. In this condition, antibodies, that is, the IgG or IgM, are directed against the cellular or extracellular matrix antigens and causes cellular destruction, functional loss, or damage to the tissues. Question number 6. In which condition should not be the hand rub used? Hands visibly soiled, before touching patient, after touching patient, after touching patient's surrounding. And the correct answer is hands visibly soiled. As per the WHO guidelines, the 5 moments of hand hygiene are before touching a patient, before a procedure, after a procedure or body fluid exposure risk, after touching a patient, after touching a patient's surrounding. But when the hands are visibly soiled, one should go for hand washing rather than hand rub. Question number 7. Pathogenic organism in the blood is known as septicemia, bacteremia, toxemia, hemangioma. And the correct answer is bacteremia. What is bacteremia? Bacteremia refers to a viable bacteria in the blood. In a healthy person, no further complications occurs because of the bacteremia. But if the bacteremia progresses and becomes a bloodstream infection, it is then known as septicemia. Question number 8. Antiviral protein is known as antigen, interferon, antibody, immunoglobulins. And the correct answer is interferon. Interferons are proteins that are the part of our natural defense. They are released in response to the presence of several viruses. Question number 9. Anti-D given to a Rh negative woman with Rh positive fetus before delivery is an example of adoptive immunity, artificial passive immunity, natural passive immunity, artificial active immunity. And the correct answer is artificial passive immunity. Artificial passive immunity is the transfer of antibodies via serum transfusion or injections. The anti-D immunoglobulin neutralizes any Rhd positive antigens that may have entered to Rh negative mother's blood during pregnancy. Question number 10. Schick test is used in confirming the diagnosis of scarlet fever, syphilis, tuberculosis, diphtheria. And the correct answer is diphtheria. Schick test is developed in 1913 to determine if a person developed some immunity to diphtheria after having been exposed to those bacteria. A small amount of diphtheria toxin, that is about 0.1 ml, is injected intradermally into the left forearm. An equivalent amount of heat inactivated toxin of 0.1 ml is injected into the right forearm. Then the test is read at 1 to 4 days. If there is no erythematous reaction, it means Schick test is negative and the person is immune and need not to be immunized or reinforced. If there is erythematous reaction, then the person is Schick test positive, means they are susceptible to diphtheria. Thank you for watching. For more updates like this, do like, comment and subscribe the channel Nurses Handbook.